You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you to the March 2025 edition of Editor's Summary. This month, my interview is with Ms. Rachel Giblin and Doctors Elena Mayasodova and Cynthia Crossan regarding their article, Trends in Anxiety and Depression Among Individuals with Rheumatoid Arthritis, a population-based study. So what were the major findings of the paper?
Yeah, so interestingly, kind of, I guess in contrast to what Cindy is saying, is we did find that there's an increasing incidence of anxiety over time. So we found that individuals diagnosed with RA in more recent decades, like specifically between 2005 and 2014, had significantly higher rates of anxiety compared to those diagnosed in earlier decades. And so although we actually did not find RA status itself to be a significant risk factor for new diagnoses, patients with RA did have this progressively increasing risk of receiving a new diagnosis of anxiety over time. And you can really see this with like the 10-year cumulative incidence of anxiety. So that rose from 6% in the 1985 to 1994 cohort up to 16.6% in the 2005 to 2014 cohort. And this increase was most pronounced among the seropositive RA patients. And actually, in contrast to this, the depression rates were relatively stable over time in both the RA and non-RA groups. So we didn't really see significant differences in risk there. And kind of like conversely to the anxiety, one interesting finding we saw was that the seronegative RA individuals in this group diagnosed in the most recent decade, so that's that 2005 to 2014 decade, were actually less likely to develop depression compared to those diagnosed in earlier periods. And then for the co-occurring anxiety and depression, we again saw this rising trend over time. So persons diagnosed with RA in 2005 to 2014 were having a higher cumulative incidence compared to those diagnosed in earlier decades. And again, even though RA status was not a significant risk factor, we did see like a 1.5-fold increase of developing both conditions for that RA group. And we also saw that within the RA group, this increase was most significant among those seropositive patients. But in terms of the interactions that we had looked at between RA status and age and sex, we didn't see that any of those factors modified the observed differences in this study.
I hoped you enjoyed listening to part of my interview with three of the authors of their paper titled Trends in Anxiety and Depression Among Individuals with Rheumatoid Arthritis. For an in-depth overview of the article, please listen to the full interview I had with the authors which is available at our website at www.jroom.org or on our YouTube channel. Both the full article and an accompanying editorial titled Mind Matters in Rheumatoid Arthritis, The Rising Burden of Anxiety and Depression, which is by Drs. Nadia Smith, Heather Wang, and Christy Bartels from the University of Wisconsin School of Medicine and Public Health, Madison, USA. These are both available for you to read at our website at www.jroom.org. Studies have shown that there is an increased risk of malignancy in patients with rheumatoid arthritis, but that biologic therapy does not increase the risk of malignancy. Nascent and co-authors examined the risk of malignancy in Australian patients with RA in their paper titled Cancer Incidence and Outcome for Patients with Rheumatoid Arthritis, a long-term population study in Western Australia. In this retrospective study conducted from patients seen over a 20-year period, the authors found that pre-existing cancer was less prevalent in RA patients than in controls. In participants without prior cancer, the overall incident rate was lower in RA and was stable over the 3 decades of the study. However, there was an increased incidence rate for both lung and hematologic cancers. Despite the overall lower cancer incidence rate, post-cancer mortality was higher in RA patients for most types of cancers. Although an uncommon manifestation of Still's disease, myocarditis, can be seen in both adult-onset Still's disease and systemic JIA. In their article titled Evaluation of Myocarditis in Patients with Still Disease, Clinical Manifestations from a Multicenter International AIDA Network Still Disease Registry, Ruscotti and colleagues evaluated cardiac involvement in patients with Still's disease from their Autoinflammatory Disease Alliance Cohort, or AIDA network. Cardiac involvement was found in 17.7% of all patients in the registry, with the most common cardiac manifestations being pericarditis, followed by myocarditis, while endocarditis and cardiac tamponade were uncommon. Although the most common feature was pericarditis, more severe clinical picture was reported in patients with myocarditis, which was associated with an increased mortality rate. The use of biologics has been associated with an increased risk of infections in patients with RA. However, less is known about the risk of infection in patients with ankylosing spondylitis treated with a biologic agent. In an analysis of 2,129 patients from the Cohort, which is a nationwide multicenter registry of Korean patients with radiographic axial spondyloarthropathy, Ko and Moon, in their paper titled Incidence and Risk of Infections in Patients with Radiographic Axial Spondyloarthritis Receiving Biologic Therapy, a prospective observational study using the COBIO registry found an infection rate of 39.4 events per 1,000 patient years. The most common infections were the upper and lower respiratory tract, followed by herpes zoster. The mean duration of biologic use prior to infection was 3.12 years, and time to infection differed according to the biologic agent used. For anti-TNF agents, the infection was usually greater than 3 years duration, while for IL-17 inhibitors, infection usually occurred within the first year of treatment. Significant risk factors associated with infection were age, female sex, presence of ischemic heart disease, complication of diabetes, chronic kidney disease, and peripheral arthritis. Use of emergency department may be avoided if patients can have greater access to ambulatory services for low acuity issues. Mokanu and colleagues examined this issue in patients with psoriatic arthritis and radiographic axial spondylitis in the Canadian Universal Healthcare System in their article titled Potentially Avoidable Emergency Department Utilization by Persons with Psoriatic Arthritis and Radiographic Axial Spondylitis, a population-based cohort. The study examined 4,984 patients with PSA and 14,690 patients with radiographic AS who had 50 3,174 and 124,037 unique ED encounters, respectively. Low acuity counters were common, comprising 42% and 53%, respectively, for the PSA and AS cohorts, with infection and injury the most common responsible diagnoses. Rural patients were found to have nearly twice the mean number of visits per year. They had a higher frequency of lower acuity presentations and were admitted less often for both disease cohorts. This study has significant implications for improving care for patients with PSA, radiographic spondyloarthropathy, and likely all patients with inflammatory arthritis. Little data is available of the epidemiology of cutaneous lupus erythematosus in the Southern Hemisphere and in multi-ethnic populations. Maylett and co-authors examined the prevalence and incidence of isolated cutaneous lupus in the multi-ethnic population of Réunion Island, France, in their paper titled Epidemiology of Isolated Cutaneous Lupus Erythematosus in a Multi-Ethnic Population of Réunion Island, a retrospective multi-center study. They found 68 cases of cutaneous lupus, of which 218 were incidence cases. The standardized prevalence of cutaneous lupus was 43 per 1,000 persons, and the average annual standardized incidence was 3.1 per 1,000 person years. Dark-skinned patients had a higher rate of discoid lupus, an earlier age of onset, and were more likely to receive an immunosuppressive agent than light-skinned patients. Generalized discoid lupus, paniculitis, and overlapping subtypes of cutaneous lupus were associated with an increased risk of progression to systemic lupus. A meta-analysis from 2021 demonstrated that patients with Sjögren's disease had an increased risk of death. Follow-up to this study, titled, I'll start again. A meta-analysis from 2021 demonstrated that patients with Sjögren's disease had an increased risk of death. In a study follow-up to this, Rasinovich, Lovgov, and co-authors in their study titled Mortality in Patients with Sjögren's Disease, a Prospective Cohort Study identifying key predictors, examined 340 patients from the Spanish multi-center cohort. Patients had a mean disease duration of 17 years. They found that the Sjögren's disease cohort had a 70% increased risk of mortality as compared to the general population. Infections, malignancies, and cardiovascular disease were the most common causes of death. The independent factors associated with increased mortality were an older age, C4 hypocomplementemia, the ESR, a history of heart failure, and pulmonary involvement with their disease. Patient-reported outcome, PROs, have been increasingly recognized as important measures of an individual's experience of symptoms and quality of life. You and co-authors examined the psychometric properties of a patient-reported outcome related to skin symptoms in patients with systemic sclerosis in their paper titled Psychometric Evaluation of Scleroderma Skin Questionnaire, a novel patient-reported outcome for skin disease in patients with systemic sclerosis. The authors administered the Systemic Sclerosis Skin Questionnaire, or the SSQ, to 799 patients enrolled in the U.S. Systemic Sclerosis Collaborative National Quality and Efficiency Register, with the acronym CONQUER. The SSQ demonstrated high reliability and moderate correlation with the modified Rodnan skin score and previously used PROS. This study provides initial support for the use of the SSQ to assess skin symptoms in patients with systemic sclerosis. However, the SSC, based on a 6-month recall of skin symptoms, had a poor correlation with Rodnan skin score. Further validation of this questionnaire is required before its implementation. Tocilizumab is an effective agent for the treatment of giant cell arteritis and has been licensed in many countries for its treatment. The aim of the study by Nagase and co-authors, titled Tocilizumab, TZZ, for giant cell arteritis, clinical outcomes following relapse and TZZ discontinuation due to adverse events, was undertaken to determine the outcome and treatment changes of a cohort of 62 patients from Japan with GCA who were treated with tocilizumab. From this cohort of 62, 23% had an unfavorable event during treatment with tocilizumab, 16% had a relapse, and 13% had an adverse event leading to discontinuation, while 6.5% had both. Most relapses occurred when the interval between doses was increased or the tocilizumab was stopped. Most relapses were managed using a dose adjustment of tocilizumab or with the addition of another immunosuppressant agent. In an accompanying editorial titled Managing Giant Cell Arteritis with Tocilizumab, Relapses and Adverse Events, Doctors Gonzalez Gay, Castaneda, and Ferraz Amaro from Spain compared the results of this study in a Japanese population to previous studies from other countries with different ethnic backgrounds. They found that the frequency and relapses and adverse events were similar across all studies. Coffey and co-authors used a population-based cohort of adults residing in Olmsted County, Minnesota, USA, over a 20-year period in their study title, Epidemiology of Antisense Syndrome and a Risk of Malignancy, in a population-based cohort from 1998 to 2019. They found that the age and sex-adjusted incidence of antisense syndrome was 0.56 per 100,000 population, with the highest incidence in the 52 to 59 age group. Age and sex-adjusted prevalences were 9.3 per 100,000. None of the patients developed malignancy within 3 years of their diagnosis, although 2 patients did develop a malignancy during the follow-up period, one at 3.3 years and one at 6.3 years. At a median follow-up of 11.9 years, 12 of 13 patients were still alive. Previous studies have shown that multidisciplinary care may lead to improved gout care and improved patient satisfaction. In their study titled Improving Gout Care in a Canadian Academic Medical Center through a Multidisciplinary Nurse-Led Protocol, Odette and co-authors report the results of their multidisciplinary nurse-led gout protocol with a treat-to-target strategy. The primary outcome was achievement of the target serum uric acid level at 6 months. They found that a target serum uric acid level was reached in 65% of the patients in the multidisciplinary care protocol, as compared to 19% in the usual care protocol. Failing to titrate medication in the usual care protocol was the leading cause of non-achievement of target serum uric acid level at 6 months. The number of patients lost to follow-up decreased from a historic of 16% to 5% following the implementation of the nurse-led protocol. This study adds additional evidence to previous studies showing that multidisciplinary care protocols will lead to improved care of patients with gout. This month's 360 Degrees of Rheumatology Panorama is titled The Trial. In this essay, the authors compare the real-world difficulties they had in dealing with non-medical people from insurance companies who denied coverage for non-routine treatment that was based on the patient's overall clinical status. They compare this to the quote from The Trial by Kafka. They're talking about things of which they don't have the slightest understanding anyway. This month, we have 2 images in rheumatology. The first one is titled Necrotizing Sarcoid Granulomatosis in a Patient with Systemic Sclerosis, and describes a 70-year-old man with anti-SCL70 positive systemic sclerosis who presented with arthralgia, fever, and weight loss. A 18 fluorodeoxyglucose positron emission tomography CT scan showed an increased uptake in hilar and mediastinal lymph nodes, the soft tissue in the retroperitoneum in a leopard man appearance. A mediastinoscopy guided biopsy of one of these nodes showed non-caseating necrotizing granuloma consistent with necrotizing sarcoid granulomatosis. The second image is titled Parathyroid Adenoma Presenting as a Femoral Tumor Lesion in a 27-year-old woman, and it describes a previously well 27-year-old woman who presented with left knee pain following minor trauma. A plain X-ray showed an osteolytic lesion in the distal epiphysis and diaphysis of the left knee. Serum calcium was elevated at 13.3 milligrams per deciliter, which had associated with significantly elevated serum PTH levels. Following parathyroidectomy, there was healing of the lytic lesions. This month, we have one case report, which is titled Effective use of apremilast in refractory arthritis associated with cystic fibrosis. I hope you enjoyed listening to the highlights of this month's edition and suggest that you read the full March 2025 edition of the Journal of Rheumatology, either in the print or online edition. The latter is available at our website at www.jrheum.org. I also suggest that you watch my interviews with the authors of the highlighted article of this month, as well as previous months if you have missed them. If you have any comments or questions on these highlighted articles or any articles in the Journal of Rheumatology, please send them to manuscripts at jrheum.com. And please join me next month for the April 2025 edition of Editor's Summary. And I want to thank you for listening.